Hi, this is Queenie Yu from Bullet Point News. Joining me is our mental health correspondent, Sue Morrison, a certified addiction and mental health counselor at White Brick Therapy in Stouffville. Hello, Sue.
Hi, how are you?
Good. So tell us about addiction.
Addiction is a symptom of something much deeper. It's trying to not feel our feelings or feel them differently. So we use a substance to change how we feel because we're uncomfortable. We're uncomfortable with our feelings in our own skin. Our life becomes um, painful or problems come up and we don't know how to deal with them. So we use something to feel different. And then that
How
progresses. Addiction is progressive.
how common is addiction?
Well, it's very common. It affects 1 in 5 right now, and addiction is a family disease. So just because the one person has an addiction, it affects everyone in the family, the spouse, the kids. Um, yeah, it's become a huge part of society, mental health in general, and I think because of the pandemic, it's increased as well.
Does it affect a certain age group more?
You know, addiction does not discriminate. It affects all ages, ethnicity, backgrounds. I think the stigma of addiction hopefully is changing. The stigma used to be quite negative, an addict. I think as time is changing and we have more mental health awareness, we're understanding that mental health affects everyone, addiction affects everyone, and I'm hoping the stigma um, decreases somewhat over time.
Why did you decide to be a certified addiction counselor?
Well, I'm in recovery myself from addiction. I'm 9.5 years abstinent from substances, and it's become a real passion. I started off hurting, then I went into healing, and now I want to help. I've got this passion that I love talking to people who are hurting, who have nowhere to turn, and who just need unconditional support, non judgment, in a safe, supportive atmosphere. And I feel honored and blessed that people would want to confide in me and talk to me.
Would some people say, wow, you were an addict before, and are you in a position to help me now?
Yeah, well, I think lived experience is huge, but I've also have the education to back it. I've studied trauma extensively, cognitive behavioral therapy, concurrent disorders, dialectical behavioral therapy. I love learning. And right now I'm doing psychotherapy as well. So when you combine the education, the lived experience, it's huge. People want to be able to talk to someone who truly understands what they've been through because they've been through it themselves, and not just been through it, but they've flourished, they've thrived. I have an amazing life now that I wouldn't change anything about it. I'm actually grateful that I went through that period of addiction because the person I am today, wow, I want healing for everyone. I want everyone to feel that way. That it is possible to change and to heal and to grow. Uh, it's possible for anyone.
I have loved ones who have a problem with addiction.
Hmm.
Discouragement is
Yeah.
what they experience a lot. Any
Hmm.
comments?
Yeah, it's when you're alone in your addiction, you feel hopeless. You feel like you're the only one who has it and no one understands. And the key, they say that the opposite of addiction is connection. Getting in touch with people who understand, who have been through it themselves, and who have survived, who have healed. That's the key, is reaching out for support, whether it be a social worker, a therapist, your family doctor, whatever it is. The key is reaching out because you're not alone. It's so common. We feel like we're alone and we're embarrassed, but there's no reason to be embarrassed. It's part of all of us. It affects everyone. We're all touched by addiction and mental health.
Precisely, you mentioned connection is the solution, but because they feel
Hmm.
so ashamed and horrible about themselves and they don't like themselves, they don't
Yeah,
want to reach out. They don't want to be seen by anyone.
right. Yeah, that's the problem. But sometimes when you get to a bottom in your life, like an emotional bottom of just feeling exasperated and devastated, that's when a lot of people do reach out. When they've hit that emotional bottom and they have nowhere to turn. then their family doctor might recommend someone for them to talk to. And that's key, finding that one person that you trust, that you feel a rapport with, a connection that understands you and doesn't judge you. And that can help in terms of like coping skills, different modalities. Like for instance, cognitive behavioral therapy is a huge help to a lot of people struggling with addiction. Changing your mindset, your perception, your thoughts that affect your feelings and your behavior. It's key, reaching out.
Sue, I really appreciate you joining us. Where can people find more about white brick therapy?
You can Google whitebricktherapy.com. Yeah, I think the key is, just talking to someone for like a 15-minute consult, seeing if it's a match, and then go from there. But yeah, there are definitely openings available, but they're sporadic and few and far between because huge demand right now. People want someone to talk to, and that's a good thing.
Thanks.
Thank
Thanks
you
so
for
much,
having me
Sue.
on the show. I appreciate it. Thank you so much, Queenie.
See you soon.